Hi guys, it's Gemma from Team Libra. March is Endometriosis Awareness Month, so it's likely that you're hearing a lot about this condition that affects 1 in 10 women. In addition to endometriosis, there's another condition that I'm going to talk to you about today, one that affects 12 to 18% of menstruating women. That is Polycystic Ovary Syndrome. There's a lot of info around about both conditions, so today I'm going to explain what each is and how they are different. Okay, let's break it down. First of all, what is endometriosis? Endometriosis is a condition whereby the cells similar to those that line the uterus, called the endometrium, grow in other locations such as organs in the pelvis or along the inside lining of the abdomen. When you are ovulating, the endometrium thickens, and then as our period arrives, the endometrium cells leave the body. For those with endometriosis, the misplaced cells also thicken during ovulation. However, these misplaced cells that may be in the pelvic organs or the stomach lining don't have the opportunity to leave the body when our period comes. Instead, they bleed, cause inflammation and pain, and then finally heal. Over time, for those with endometriosis, scar tissue can form on the lining of the abdomen, causing the uterus, ovaries, fallopian tubes, and bowel to stick to each other. Endometriosis can cause painful periods and may reduce fertility. So, how does this compare to polycystic ovary syndrome? While both conditions involve a woman's reproductive organs, they are quite different. To begin with, girls produce the hormone estrogen, whereas guys have all that brooding testosterone. However, in addition to estrogen, females also have the male hormone androgens, but in smaller amounts. Sometimes ovaries produce more androgens than what's considered normal for a female, and this is called hypoandrogenism. These high levels of male hormones can tamper with our healthy ovulation process, and the imbalance can even cause some little follicles to grow off the ovaries. These follicles lead to the formation of cysts, and that's exactly where the cyst part of polycystic ovary syndrome comes from. So, while both conditions affect the female reproductive organs, polycystic ovary syndrome is a hormonal condition, and endometriosis is a disorder relating to the endometrial cells growing outside of the lining of the uterus. So, what are the symptoms to look out for with each condition? For endometriosis, the biggest symptom is severe pain during your period. Other red flags include pain with sex, abdominal, back or pelvic pain, discomfort when going to the toilet, and heavy bleeding. Polycystic ovary syndrome, on the other hand, may present symptoms such as weight gain, irregular or really heavy periods, significantly increased hair growth, acne, or other menstrual problems such as not getting your period at all. Okay, let's move on to the causes. Unfortunately, this is where similarities between the two conditions lie. For both endometriosis and polycystic ovary syndrome, there is no clear-cut answer on the cause. However, links have been made to family history. Insulin resistance and lifestyle factors are also thought to contribute to polycystic ovary syndrome. Lastly, treatment. While there's no known cure, endometriosis can be treated with medication, surgery, or both. Removal of scar tissue with surgery is the most effective treatment to reduce the chances of it returning. Alternatively, polycystic ovary syndrome can be managed with lifestyle adjustments and medications. Okay ladies, that was a lot to take in, but knowledge really is power. I hope today's session has given you an understanding of two femme health conditions that are so common but often really misunderstood. For more info and support, your GP is always the best starting point. Also, feel free to reach out to me via Instagram or libragirl.com with your questions, and like always, we will talk it through girl to girl. Until next time,